Hello fam, welcome to another beautiful edition of Annie Otto's vlog. If today's your first day watching me, you are welcome. If you're a returning fam, thank you so much for coming back. I really love and appreciate you. Please like, share and comment on my video. In today's edition, I'm gonna be zooming into health and I'm gonna be discussing about the most important lab tests and diagnostic tests that you need to do to keep your health in check. Whether you're sick or not, go and see your doctor once a year. Do labs, do diagnostic tests. So these are the labs that I want you to do at least once a year. Number one, lipid panel test. So this lipid panel test tests about your cholesterol level, your total cholesterol, your high density lipoprotein, your low density lipoprotein, your triglyceride. So this is one of the things you need to check your cholesterol level at least once a year. Number two, basic metabolic panel, BMP. So this checks about your blood glucose level, your kidney function, your acid base balance, your metabolism, your fluid and electrolyte balance. Number three, comprehensive metabolic panel, CMP. In other words, it's in addition to BMP. So the doctor will order for your liver function test, your kidney test, your blood glucose test, your protein level test, your fluid and electrolyte balance, and your metabolism. Number four, comprehensive urinalysis. So you go there, you pee in a cup, they will take it to the lab and pass it through microscope, and they will also look at the color of your urine as well. It can dictate infection, urinary tract infection. It can also dictate your kidney function, your pH level, ketones, blood, leukocytes, nitrates, bilirubin, as well as urobilinogen. Number five, thyroid panel. So your thyroid panel checks about the glands that regulates metabolism, your growth hormone, your body temperature, your heart rate, and other hormones in your system. So these thyroids are thyroid stimulating hormone, TSH, and your thyroxine, T3 and T4, and thyroid antibodies. So the thyroid panel test will test for all these three. Number six, complete blood count, yes, CBC. So this measures the range of your white blood cells. So white blood cells are the cells that fight against infection in your body. Red blood cells, these are the ones that carries oxygen through your system. Platelets, this helps your blood to clot whenever you're bleeding. Hemoglobin, the oxygen that carries protein in the red blood cells. Hematocrit, so this is the amount of red blood cells in the blood. Number seven, prothrombin time, so PT. So this measures the time it takes for your blood to clot. The PT and the PTT is being measured in this panel. Number eight, colonoscopy. So colonoscopy is a type of medical exam that uses a flexible tube with a camera at the tip of it, and it's being inserted through your anus. Then it goes through your intestine, the large intestine. So this is to dictate if you have polyps, if you have precancerous cells, or if you have colon cancer. So guys, colonoscopy is used for early detection of colorectal cancers. So this involves the rectum and the anus as well. In this case, if you have any type of precancerous cell or you are at high risk, that means it runs in your family, this could be done very often, but otherwise it's done every 5 years. Number nine, occult blood test. So this is when you go to the doctor, they will give you a container that you take home, you poop, you send your poop to them. That's a portion of your poop sample. You send it out to the lab that has address and everything that was sent to you. You send it back to them. So they will check if there is blood in your poop, and the doctor will call you in for the result. Okay. If there is no sign of blood in your poop, this could be done every 5 years. Number 10, Pap smear. So pap smear is for women. This is a type of test that the doctor goes into the vaginal area to the cervix, the mouth of the uterus. The doctor will collect some specimen there, swap it and take it to the lab. So this is to dictate pre-cancer in the cervix area, cervical cancer. You know how they say that early detection helps in cure. So pap smear is being initiated whenever a woman turns age 21 all the way to 65. Okay, so this is done annually. If there is indication for it to be done, that means if the woman is at high risk, it runs in the family, or there are some precancerous cells detected. Otherwise, pap smear will be done every 3 years. Number 11, mammogram. I have done mammogram a couple of times. It's not a joke, okay? Because they're gonna press it. So mammogram is a type of breast x-ray to detect if you have any lump or any cancer or dents in your breast. That's what mammogram is used for. Mammogram is recommended from age 40, but if you have a family history of breast cancer or you are at high risk of developing breast cancer, it's going to be done every year. But otherwise, mammogram is being done every 2 years. So from age 40 all the way to 74, mammogram is being done every 2 years if you're not at risk. If you are from a family at risk, you start your mammogram at age 35 and it's done once a year. Number 12 is for the guys. So prostate exam, it can be done in 2 ways, digitally or by blood. Okay, so digitally, you go to the doctor will put finger at your anal area to palpate your prostate to see if it's enlarged or not. Then the doctor can also draw the blood, take it to the lab to test for your PSA level. So that's the prostate specific antigen. If it's within normal limits, then your prostate exam will be done every 2 years. Otherwise, if there is something concerning, the doctor will do it every year. So guys, let me tell you, if you are going for prostate exam, please do not have sexual intimacy for 48 hours before you go for the prostate exam. Your PSA level will rise. That's the prostate specific antigen level will rise. So on a general note, after all these 12 things I have mentioned, please monitor your diet, exercise, lose weight, reduce your stress level, pray, have yoga, be at peace, be happy. Don't let anything hurt your mental, emotional, and spiritual health. Very, very important. Financially, do your best, okay? So endeavor to pray daily, stay connected with the Lord. Please take care of your health. Don't wait until things become severe or bad before you start running hater-skater. A lot of people have dropped dead in the church, in the parties, in the market, at school, at work. It is happening even here in America. Let's do the much we can within ourselves and leave the rest to God Almighty, who is the author and perfecter of our faith. That's all I have to tell us. Please take care of yourself, your family members, your loved ones, and your friends. Remind them to go and have a normal body checkup and diagnostic test done at least once a year. Thank you all for watching another beautiful edition of Annie Otta Vlogs. Like, share, and comment on my videos. I'm your girl, Annie Otta. I love you guys. Please stay safe. Bye guys.